We have now reached agreement on changes to the GP contract in England for this year. This will deliver a much needed increase in funding for pay and expenses, provide further funding to cover rises in indemnity, and will put in place improvements related to practice premises. These amendments and interim funding should help practices provide some stability. But I'm also clear that they will not solve the fundamental issues impacting general practice, which is why GPC is committed to focus on the bigger issues over the coming months. Taken together, however, these changes deliver a total of £256 million of new investment for the coming year, which is significantly more than we've secured in recent years. And this will increase further should we achieve a positive result from the DDRB process on doctors' pay. After years of pay cut after pay cut, we rejected the offer of a 1% pay rise, and instead have provided strong evidence to the review body that doctors should be given a real terms increase in pay to start to address the major recruitment and retention crisis facing general practice and the low morale of GPs. GPs have also had to cope with the soaring cost of indemnity cover, effectively paying a tax in order to practice, something not expected of our hospital colleagues. Therefore, I am pleased we have secured a further £60 million to cover the rise in indemnity for the last 2 years, as well as a significant commitment to a state-backed indemnity scheme to be introduced from April next year. GPC has also won a commitment from NHS England to conduct a fundamental review into practice premises, which forms a major strand of work for us as we look to solve some of the big issues facing us all in the year ahead. CCGs and hospitals are already working towards the full use of the electronic referral service by October, and in line with this, practices will also be expected to use this system. So we've secured new funding for this, and we're producing detailed guidance to support practices and have agreed that implementation will be supportive, not punitive. Importantly, we'll be also closely monitoring any workload implications or implementation issues in the coming year. You can find the details of all the contract changes on the BMA's website. Whilst contract negotiations are important, there is much work to be done and progress to be made in other areas. GPC will continue to put pressure on and work with the government and policymakers to get general practice the funding and support it needs to guarantee the future of the profession and to save general practice for the sake of our patients and for the wider health service.